on somebody else. She's tapped out. Great. Been working it out. No, Jackie just brought her. Oh, the name. Yeah, no, she's with Jackie. Jackie just recruited her. Issue number 9, again, the panel will include, again, the department representative, Sandra Smith, council member, the State Council on Developmental Disabilities, Gloria Wong, executive director, Eastern Los Angeles Regional Center, Marty, again, Amoto with CDCAN, and Ms. Blakemore, Disability Rights California. Each panelist has specifically been asked to address an item in a question in the agenda, and their questions can be found on page 27. And we'll start with the department with your list of questions on page 27.
Thank you. Nancy Bargman, Deputy Director of the Department of Developmental Services. Statute was enacted in 2012 requiring the department and regional centers to annually collaborate to compile data relating to purchase of service authorization, utilization, and expenditures by each regional center in respect to consumer age, race and ethnicity, primary language, residence type, and disability detail. By statute, DDS and the regional centers must annually post this data collected by December 31st of each year. Within 3 months of compiling the data, each regional center must, with stakeholders, hold stakeholder meetings, at least one or more public meetings. In scheduling the public meetings, regional centers must inform the department and post meeting notices on their website, send meeting notices to stakeholders and groups representing underserved communities. Additionally, regional centers must consider the language needs of the community and scheduling meetings at times and locations that will maximize the attendance, especially by those underserved communities. Regional centers must present the data in a manner that is culturally appropriate and in the consumers or the family's preferred language. It is not a requirement for the regional centers to address diversity and access issues in their performance contract. However, as part of their contract with the department, regional centers are required to submit to the department proposed strategies to address disparity issues. Examples of some of the strategies that were in the 2014 plans from the regional centers include training staff and board members on cultural competency, hiring staff and recruiting service providers that are multilingual, and then partnering with and reaching out to families, family resource centers, school districts, and other means and partnerships. Identifying peer support partners, creating committees to look at disparities in services, and implementing mobile assessments. We were asked how does the department measure the delivery and outcomes of culturally appropriate services by regional centers? First, the delivery and outcomes of services starts with the individual program plan at the local level. We also, as a department, though, we focus a lot on the NCI survey process. Although this is a relatively new process, it is an area that we believe that has been able to evolve to capture some of the important elements that are going to be critical in assessing satisfaction and outcomes. The NCI survey really is a means for us to measure the outcomes of culturally appropriate services. Let me give you an example. The Family Guardian Survey, in which we do have implemented at this time, they have targeted questions that relate very specifically to cultural sensitivity, such as the question is asked, are services delivered to your family member in a manner that is respectful to your family member's culture? Also, if a family does not speak English, are there enough support workers available who can communicate with them? There's about 7 different questions that are very specific and targeted, and this was by design based on feedback within the stakeholder process that I mentioned earlier. Also important, regional center board composition, ensuring that the regional center governing board represents the geographic and ethnic characteristics of their specific geographic area has been the focus of the department and the regional centers. Statute enacted in March 2011 requiring the governing board of each regional center to annually submit to the department detailed documentation demonstrating that the composition of the board conforms to the statute. Since 2011, it has been demonstrated improvement by regional center in this area. As discussed, DDS and regional centers have compiled data for the last 3 fiscal years regarding disparity data for 11-12 fiscal year, 12-13, and 13-14. The regional centers are in process of holding their community meetings and developing their strategies to respond to the disparity data for fiscal year 13-14. The department reviewed the statewide data and completed a very limited analysis of the comparison of fiscal year 11-12 data to 13-14. Now, remembering that we just received this data because it was received as of December 2014. Unfortunately, the department has, as I've mentioned, only limited time with this data, has not completed an in-depth analysis, but a high-level comparison of the statewide data reflects some areas of concern for the department. Specifically, in comparing the data, as an example, for expenditures and authorized services, this is statewide, this is not specific to any individual regional center, but statewide, between fiscal year 11-12 and compared to 13-14, by ethnicity, the gap for the average expenditure and authorization per capita between Hispanic and white has not improved. While we would have preferred to come today with a more in-depth analysis, we are only at the beginning stages of reviewing this data and the detail behind the information. In the coming months, the department will drill into the detail of the data. While we know the regional centers have developed and implemented many plans to address areas of concern as it relates to disparity or access to services within their given geographic areas, we're also aware that many of the initiatives have only recently been implemented, and as such, we're not fully clear or understand what the impact has had to address the diversity and access issues. The department continues to be very committed to identifying these issues and the concerns and take the necessary, and it's very committed to taking the necessary actions to address this very significant issue.
Because you need to leave, you want to ask questions of each panelist or go to the end? Okay, all right. Thank you. We're going to move to, we'll do all our questions to the entire panel as we've done most of today. Ms. Smith, Council Member, State Council on Developmental Disabilities.
Thank you, Madam Chair. It's glad to see you again. I don't know if you remember me, but I am Chad Smith's mother, and you've seen his artwork before.
Yes, I have.
Yes. Yes, so I'm representing the State Council here in reference to disparities. I want to first tell you a story, a friend's story. Part of the Regional Center services for over 25 years. She had a son that was fragile medically and also African American. And I would hope to believe that ethnicity had nothing to do with, nor his fragileness had anything to do with it. But in the end, my friend spent a year trying to get more services for her son because she needed to have surgery on her knee. She carried her son around on her back until the day he was 25. The day he died in the hospital, they called her and said their services have been provided. She said, you can close the case. He just died. It took her a year. I have made calls myself personally. My son is 33. He's an abstract artist, looking for career ideas. The loss of what we were talking about before, of the recreational and the services that just can build a person within their community, it's not there anymore. My son still needs a job. His job is to go take pictures, draw pictures. That service is not available. I just lost those hours recently. As of Monday, I lost those hours. So this is personal for me. This is real for me. Like you said, these are people. These are not statistics. These are not numbers. This is life. I live here in Sacramento, so it was very easy for me to come today, and I appreciate everything I've heard today. I see that everybody on this panel is all in the same page that I am, and see that the need is back there. We can't clap. I wanted to clap. But the need is there, and it's dollars and cents. In order for the services to be provided in a more, say, personal way, need more case managers with smaller loads. There needs to be the training that they're speaking of. You have to have some diversity training. I used to teach, and it's well known that there's all kinds of disparities. I had no idea that I would find it in this arena as well. It's a quite sad state of affairs. So I say, and not to put anybody in the point, yes, put somebody in the point, let's get those stats together and let's pay attention. And make sure we're talking to the people we're talking about. Because are they the ones that are coming here? Are they the ones that are coming to the town? How are we getting those folks who really need it? Thank you for your time.
Thank you very much for being here. Appreciate it. Gloria Wong, Eastern Los Angeles Regional Center.
Appreciate. Thank you, Chairperson Mitchell and committee members. My pleasure to be here. I'm representing ARCA, the Association of Regional Center Agencies. ARCA and the regional centers appreciate the committee's interest in the important issue, and we remain committed to ensuring that POS expenditures reflect the individual families' service options choice, which meets their cultural preferences and values. This is a very unique issue for East LA Regional Center based on the demographics of the population that we serve. We have approximately 10,000 consumers as part of Eastern Los Angeles Regional Center, and we have 70% Hispanic, 12.5% Asian. So 82% of our total population is what we may call a minority. They are our majority. So really, when you look at our statistics, it's very telling about what is happening in that given demographics. So I'm delighted to be able to give you my perspective and the association's perspective on this. Certainly the recent history on the reductions that has been talked about so much today, the $1 billion certainly has made a huge impact on the results of the purchase of services expenditure plans. You've heard repeatedly, and I'm going to repeat it again because it's so essential. The reductions of the services that were made in 2009-10 impacted the minority groups tremendously. And that is, you have that on the LAO report, which identifies the in particular, the camps, social recreational services, non-medical services. But I think one of the things that wasn't mentioned, what also happened then, respite services was severely reduced so that it became a uniform standard for 21 regional centers. All of these services are essential to a group made up of Hispanic families that tend to use our highest expense services, residential services, minimally. In our regional center, just to give you a perspective, 81% of our total population, the 10,000, are in home. They're living with their families. So when you isolate out the residential cost factors, those high cost factors, it does narrow this gap, but these services that we just talked about were essential to these families to keep those families unified. And so the fact that we don't have that available to us now, from 2009 to 2010, it's impacting the results of this expenditure, POS expenditure report. They've lost ground, and their baseline has dropped off. But this commitment from this particular community in terms of not utilizing placement is resolute. Because regardless of the fact that these support systems have vanished and are not there, there has not been an uptick for us on the residential placement. So it really is a show of commitment, dedication on the part of these families, and I think this is time now for us to consider, as everyone has said, the reinstatement of these critical services to these families. And I think we will begin to see over the years a slight difference in this expenditure trend. So the issue of reductions, the $1 billion and what was $30 million, I believe, the LAO report on reductions, that would go a long way in trying to make some per capita differences. So I encourage you to reconsider that particular aspect. Caseload ratios has been talked about repeatedly, and I just want to reiterate the point. In order to be able to best serve the minority families, to guide them, if they're monolingual, to guide them through the system, it's essential that we have a lower caseload ratio. I'm reiterating points that have been made repeatedly, but I need to, as a regional center representing 70% Hispanic families, how valuable this would be for us. I think best illustration that I can give you, because you've heard so much of the support on this particular topic, is the illustration of how successful a lower caseload ratio can be. And most recently, we just closed as a system in Lanterman Developmental Center to great success of the closure at the LA County area. And one of the reasons for that success, 1:45 ratio. When you have the right numbers, we can really do miracles. We can make a huge difference. That's the best illustration that I can give you most recently that did show that lower caseload ratios can make a difference. We need a lower caseloads ratio to be able to work with families, navigating them through the system if they're monolingual. The one thing they ask us for is training. They ask for direction on what is a complex system, that has been said before. So it's essential that those two pieces, I think the reinstatement of those services that were cut, plus the caseload ratios are the essential pieces. Finally, I will say that forward-looking to things that we can do as an association, and I'd like to share with you briefly. We did enact what we're calling the Equity Committee for the Association of Regional Center Agencies. It's meant to identify best and promising practices that will reduce service disparity in our system. To that end, what we did is we sought out research is what we think is the most critical. I know I can give you speculation, I can give you my perspective, but we need some tangible evidence and a research entity that can go out there and make these determinations. To that end, the Equity Committee has sought out applicants for the research project. I can say it's not funded. We have no funds for that, but what we're doing is whether we can maybe potentially seek endowments from given agencies. So we did secure the services of Children's Hospital of Los Angeles County. We are hopeful that we can get this jump-started fairly soon. It'll first be a planning process with the 21 regional centers so that we can just identify the particular area and focus that we want. We think certainly the POS expenditure report is already a good source of them to do their research. You can look at your lowest funding families versus your highest funding, trying to understand what those differences are between them and the in-between rates. So I think that the research project can really highlight a lot of information for us, and we're very eager to have this project started. We were just, this was just last week, this Children's Hospital was notified of the selection process. So still some work for us to do, but it is a commitment that we've made as 21 regional centers to something that we think is essential. Additionally, I just want to highlight some regional centers have taken independent projects to try to better understand this diversity. Golden Gate Regional Center has worked with Stanford Design School to assist in developing and piloting more effective methods to connect with underserved communities. Lanterman Regional Center has worked on a pilot project with Esperanza Community Housing Corporation about the last year and a half, and what they did there is it was a small project. I believe it was about 50 cases, but they gave these cases to this particular organization, and I believe it was a 1:25 caseload ratios. They had 2 workers, and they were trying to just understand from that, what is it that the issues are. It was very successful from our understanding in the end that there is an improved, in that short period of time, an improved access to services, generic as well as the regional center. The issues are very complex. I won't take your time, having to do with socioeconomic issues, but I think we need to be sensitive to what we've learned from these studies. A couple of others that I would just mention is Far Northern Regional Center is working with DRC and State Council, hosting an event to examine the impact on ethnic culture and social class on access to human services. And finally, Central Valley did receive a grant for outreach purposes to the minority communities. A final piece that I would add in terms of future potential solutions or ways to assist, it's been talked about self-determination, which is a project that we hope to be coming to light fairly soon here. We're not quite sure. But as a regional center system, what we have done, and you've heard the discussion about a local advisory committee. So the 21 regional centers have already made a commitment to establish, whether you already have or it's pending. It's a work in progress. We recognize that what's important right now is to begin to do the outreach, the publicity that needs to be made so that individuals such as those that are receiving the lower per capita can potentially sign up. It's a very small number, 2,500, but we do think that this is the opportunity to pass the word on to everyone. So we are starting the local advisory committees, which will then kick off and launch an outreach project for the very small numbers of individuals, but that will generate an interest list to be established by the regional centers that will then be submitted to the department. So we'll be at the ready the moment that this application is approved. We think that this certainly can play a role in the POS expenditure aspect of this from the perspective of that you will have greater flexibility on those services. If these services are not instituted that I mentioned earlier, you've got greater latitude on something that's unique to you and your cultural values. It doesn't go as far as financially making things even, but at least it's a good start. So,
Because that is the core issue.
yes, it is, but at the very least, that's a starting point, giving people flexibility. With that, I will just thank you once again for taking the time to listen to these issues of concern. This is a common issue for us as a regional center system and wanting to find solutions. Thank you for your time.
Thank you very much. Mr. Omoto.
Marty, Marty Yamamoto, CECAN, I forgot where I was, family member. I just wanted to mention that the issue of disparities is about babies, it's about children, it's about people and older adults, who need access to services and their families. My family was quite touched by that with my sister. And I also participated in some of the earlier stakeholder groups way back to the original Healthy Families outreach. You might have been part of that. And some of the later studies, one of many by DDS and the regional centers, the POS study, Purchase of Services study, that tried to look at how services were delivered and whether there were some disparities based on culture or language or other factors. And I think that study came out with some indications there were, and it was contested by some, and some of us advocates didn't agree with the end result of that. But I think what has happened over the years is that while there were different views then of if there was a problem, I think there's now a shared view that there is a problem regarding disparities, cultural as well as linguistic, and that the problem needs to be addressed. So that there is progress being made. The problem is, though, whatever success we've been trying to reach together as a community, regional centers, the department is compounded by the enormous problems of ongoing budget cuts and also policy changes that limit eligibility and do other damage to our community. And so I totally agree with the points made by my colleague Gloria. An example to that is my own son, Jason, who works in providing ABA services. He's Japanese American, he's fluent in Spanish, which is an odd thing to see him talk when he's talking in Spanish. But he goes into Spanish-speaking homes and to young children and speaks Spanish to them. And he tells me that often they get notices in English from the various services agency, including the regional center. Often they even get provider services who only speak English. And he says how much that this is something we already know, that how people can be so terrified when they don't have access to the right information. So next steps. One thing is to really consider funding those types of services that will actually help all of us be in compliance with achieving eliminating cultural disparity and linguistics disparity. Advance efforts to the other areas that we are working on, the Developmental Services Task Force, the Home and Community-Based Services, regulation group that is trying to get our programs into compliance. There are other reforms regarding caseload and rates and caseload ratio and operations. All those should be tied to the issue of complying and trying to minimize and address the issue of cultural disparity and the related issues. And also continue these oversight hearings on these types of issues, because I think it's very good for all of us in our community to know that the legislature is actually watching. Thank you.
Thank you very much. And we'll end with Ms. Blakemore, Disability Rights of California.
Thank you, and I'm going to try and be brief given the hour. I first want to thank those of you that have been focused on this issue for some time. I do think just the awareness and the transparency that the reporting requirements has been a very good thing, as has new requirements regarding translation. On page 13 of the materials I provided, I gave you charts that point to two kinds of disparities. I provided it for West Side, South Central, San Andreas, and Inland Regional Center. And the two types of disparities that there are who isn't getting any purchase of service from the regional centers, and that is disproportionately traditional minority communities. Community of color get higher numbers, higher percentages of those folks get no purchase of service expenditures. And then of interest is Inland Regional Center, which has even a higher rate of no services provided. So there's also geographic disparities. And the second is, what is the average amount of money we're spending? We've given you charts for individuals that are ages 22 and older. That was purposeful because those are the individuals who sort of have more regional center services since they're not getting education services. And that also points again to the disparities that we've all talked about, where community of colors receive fewer expenditures for regional centers across the regional centers I've shown you, and frankly, all others. So with that, I want to just talk about some things that we think that could be done to make things better. It's good that the regional centers have convened a group and are doing a research study to get to the bottom of that. I would encourage that there's lots of stakeholders that work in these communities every day, and that there ought to be a process similar to what we've done with other issues of really gathering stakeholders and looking at what the data tells us, and more importantly, what the fixes are, and what are the outcome measures that we're going to use to ensure that the disparities are reduced. Second, we ought to separately collect data about the self-determination program when it goes into effect to say, does that model of service, in fact, do a better job of reducing the disparities than the more traditional model? It's sort of an interesting point of comparison. And one of the reasons I think that program has the potential to reduce disparities is it specifically allows a person's budget to be adjusted based on prior unmet needs that family had. So your expenditures could really go up if you were a person whose needs had been unmet in the prior year. I think we need to analyze the data around translations. The law change went into effect last year, and so we should be able to, this year we should be able to track how much money was spent on translations in 2013 and how much money was spent in 2014. We should be seeing an uptick in that because the law is now crystal clear that regional centers are obligated to not only provide it in threshold languages, but in the individual's primary language. So there should be many more documents, IPPs, informational material, et cetera, translated so that individuals both understand what services are required to be provided to them, as well as getting information about the array of services that they can expect. We know from our conversations with our clients' rights advocates and some regional center directors that it can be challenging to get documents translated from the regional center, and that there can be delays in that because the translation company or for other reasons are delayed. So Asian languages in particular pose a problem. But rather than have 21 regional centers trying to find a translator, isn't there like a more efficient way to do that? I mean, can't we just have a contract, and that contract, or two, north and south, I don't know, north, south, and central, so that we can more effectively get documents translated in a timely way for individuals rather than everybody trying to figure it out on their own. We should also look at ways to increase culturally competent services. Some of those we've talked about today, which is reducing some of the, eliminating some of the caps that have been imposed and the services that were delayed. Look at ways in which people can get services closer to their home, which might be through a community center, but with supports, as opposed to having people get on buses and drive across all of Los Angeles. And then target some of the rate increases to ensure that there's language access. So as was noted, providers don't always provide information in a person's native language. They struggle to find staff who can communicate that way. One of the best ways to ensure that people are getting culturally competent services is to have that provided in their native language, but we may need to adjust rates and target some rate increases to achieve that. So thank you.
Thank you very much. Senator Money? Yes, go ahead.
So I think this is for Ms. Blakemore. On page 13, you cited the data on the racial disparities.
Yes.
How can the expenditures be so much greater for one category than others?
I think that is exactly the correct question to ask. And the solutions I was talking about need to lead us to both. What is that? I think it's a variety of factors, including some services not currently being available, people not having access to information in their native language so they know what services are available, high caseloads, caseworkers that aren't bilingual and therefore can't communicate as effectively with their consumers. So we're really saying it's time to understand. We all agree there's disparities now. That's a good step forward. But let's understand what contributes to it. And most importantly, what are our agreed upon outcomes we're going to achieve to eliminate the disparities?